I think modern oncology care is all about coordinated care and access to subspecialists. So by now, just having prostate cancer does not mean that you have prostate cancer, but there are different flavors of prostate cancer, different clinical situations. Just having kidney cancer, which is my specialty, does not mean that you have just kidney cancer, because there are different flavors of kidney cancer. So you need to have access to first a specialist that is really able to diagnose the cancer appropriately, and that lives and starts with the pathologist. So you want to have access to truly subspecialized pathologists, which in some instances is not really that critical. Let's take breast cancer, for instance, or kidney cancer. The pathology itself is relatively straightforward under the microscope. But in other instances, let's take sarcoma, it's absolutely critical to have your pathology reviewed by a subspecialist with focus on sarcomas. The second piece then is to have access to a multidisciplinary care team. Modern cancer care these days really is focused on multidisciplinary care. So you want to make sure that you have access to the medical oncologist, the radiation oncologist, the surgical oncologist, and ancillary services like genetic counseling, molecular testing, what we call survivorship. When you've been treated and hopefully cured from your cancer, who's going to manage potential side effects of the treatments, things like that. It's really not just treating the cancer with chemotherapy or cutting it out or radiating it, but it's truly a multidisciplinary approach. And that sometimes is challenging to find in community settings. That's obviously where NCI designated comprehensive cancer centers come in, but that's also the benefit of a second opinion.